Right on, guys. Back with you again. Yeah, it's the same day. Another video. This one is about my flexible cystoscopy. This is probably, um, if you can hear odd voices in the back, it's my voice, African Grey. It's like when people think they're talking on the phone. Um, this is probably the sort of test that's going to put the wind up a lot of men, possibly a lot of women. Depends what you're suffering with, really. And this is where the invasive tests begin, really. If you're at this point where the doctor has asked for a flexible cystoscopy, they're really stuck for answers on what is going on with your bladder problems, either because there's concerns or problems inside, or because they just don't really, like with me, they just don't really know what's going on. Um, so anyway, they send you for a little booklet what flexible cystoscopy is all about. It really describes the procedure. So anyway, no, I wasn't overly nervous really because my dad had had one, so it's a bit uncomfortable, can be a bit sore. Most of the descriptions you'll read online state it can be a bit sore. I'll come to that in a minute. So anyway, I went up to Trellis to the urology department, outpatients treatment unit. Again, it says come with a full bladder. As soon as they get in there, you need to have a urine test. Basically, so there's check there's no infection. I can't remember if I had to have one 10 days before. Sometimes they'll ask for one 10 days before, but then you still got to do one on the day. I was due into the unit, I think, at 9 o'clock for my procedure at 9:30. There was an old boy in front of me who was obviously had prostate problems, struggling to go for a pee. When he did go for a pee, they called him on one side. I imagine he must have had an infection, and they sent the poor chap home again. Which obviously, if you've been worrying about having it up to that point, it's not really what you want to happen. But they can't do it with an infection. Lucky my urine test was clear, so I got to go in quicker, which is probably better than sat there waiting around. Anyway, you sign a consent form because it's an invasive procedure. Flexible scopes, I imagine, are very rarely done on children whilst they are awake, or certainly young, teenagers, because it's not a very pleasant experience for an adult. I would imagine you'd have to have quite a very laid back, relaxed child. Obviously, the scope sizes are different. You've got pediatric scopes, which are about 6 to 9 French gauge, and adult scopes, which are about 14 to 16 French gauge. In terms of size, about the size of a pencil for the average guy with a normal urethra. It should go comfortably up inside. Now, if you're into urethral sound as part of your bedroom activities, you have some idea when it stings a bit afterwards. No, it's not my cup of tea at all. And obviously, I think any bloke that's obviously not used to having something put up through your shaft, basically, sort of thing, is going to be a bit daunting, sort of thing. So anyway, they take you to a bay to get changed, put a gown on. Funny enough, they allow you to have your t-shirt on and your socks. Apparently, it makes blokes feel less what's the word? Less vulnerable. I don't quite. No, it didn't bother me at all, sort of thing. No. So you also got to take your boxers off, or whatever you're wearing, and then they take you across into the procedure room, basically, whether you're a urologist or a registrar, will do your flexible cystoscopy. I was, because I got a condition called bifid urethra, which is quite a rare genetic anomaly. I'll show you a picture here in a minute, which shows a normal urethra and my urethra, which is type 1A. Excuse the crude drawings. I'm not the best at anatomical drawings, and no, they're not the scale at all. But basically, my urethra open is probably about half the width at the tip that it should be, because I got basically a live urethra and a blanked off urethra. At the time, for this flexible cystoscopy, we still weren't aware really of whether I had two lives or whether I had one live or one blank, and what could be causing my flow problems basically. So it was a bit of guesswork. Type 1A apparently is more common, of a um, less common problem. Females, it is extremely rare. I always thought it was normal. I've grown up now, my whole life thinking this is how my bell end looks, until I started watching some of the cystoscopy videos on YouTube. I thought, hang on a minute, no, my bell end is not normal. Because then I started looking up bifid urethra, which gives all the. And I thought, oh, perhaps this is the cause of my problems. If something is strictured over or something has gone wrong. Yeah, given the size of the scopes and the size of my opening, I was a bit nervous. Some threads talk about the nurses doing the prep. Guys, if you're worried about getting a hard on, unless you really get a hard on for literally nothing, and maybe if you're a teenage lad or something like that coming in for a cystoscopy, which would be pretty rare, or you are particularly sensitive, no, or you're the sort of person who gets turned on by having something put up your shaft. This isn't it isn't anything sexual at the end of the day, sort of thing. It's not certainly gonna turn me on at the end of the day. And there's normally a lot of talk of nurses doing the prep. This might happen in some hospitals. They are there basically to assist the registrar or the urologist. I had a young registrar, not the urologist I was expecting. I knew Mr. Hodgson wasn't going to be doing it, but I knew it was going to be one of the other senior. Thought it was going to be one of the other senior urologists. So anyway, they come in and you're lying on a bed on a pad, and they lift your gown back and they wipe all your bell end down with some antiseptic wipes, and then they inject. He had to pick a hole basically, which is first time lucky with me. It was the right one. And they inject about 100 mils of what they call lidocaine, which is a local anaesthetic lubricating jelly. It feels a bit strange because it's got antiseptic in it as well as local, and obviously they're injecting quite a lot in one lump. You'll see some American clips where they use a penile clamp. They might use this in theory. They don't tend to use this in flexible cystoscopy, so they tend to just stand there pinching your bell end, which and making conversation, which you just got to get on with it really at the end of the day, sort of thing. It's a bit surreal. You might have a female urologist doing this at Trellis. There are now 2 female urologists. I think when I went for my procedure, there wasn't any female urologists there at the time. This was a male registrar anyway. So yes, it's a little bit strange. The only other person who's been that intimate, that close, was been my wife at the end of the day. So they hold your tip shut for a few minutes just for the gel to do its thing, because obviously this is what's stopping you from having any pain. Now, if you go and they do not offer you lidocaine, then they are doing something wrong. No, this is a necessary part of this procedure. Do not at any point let them attempt a flexible cystoscopy. They use this basically for catheters as well, but do not let them attempt to do a flexible cystoscopy, male or female. I'm not sure they tend to bother with lidocaine so much for female, because they've only got females have only got about 1.5 inches of urethra. They should still use lidocaine, but I think they tend to put it on the scope before inserting it. In my case, I've got quite a long lymph shaft. I am, quite a well endowed man. I'm not porn star size, but there's enough. There's enough hanging there, limp, and obviously, if you've got quite a small limp penis, then you might be lucky that the gel might reach the prostate and the bladder sphincter. In my case, it didn't. So anyway, when they think it's done its job, 2 or 3 minutes, 4 minutes maybe pass by. They pick up the scope. Like I said, it's about the size of a pencil. It's flexible. if you're an engineer, it looks like basically looks like a borescope. Basically, is that kind of size. You can look up videos on YouTube which actually show you what they are, what they do. They got a flexible tip on the end. It's all connected to a screen, so you can actually see the scope being passed up your shaft, which is a bit strange. And the nurses there, they run water, saline water down the middle of this, just to open the passages up. And it started passing up through my shaft, and I thought, oh, this is right, actually. No, it's not causing me any pain. Can be a bit of a bump. Sometimes it goes through a prostate. If you've got strictures, at this point they may stop the procedure, and you then may get referred for a rigid. But everything was clear up to the prostate. Prostate was fine. Unfortunately, this registrar did not warn me when it went through the sphincter, or asked me to bear it down, or relax, or breathe out, or any of the things they ought to do. And it was a case of ow, 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 as it went through the sphincter. When it was through the sphincter, it just feels weird. It feels like you want to pee, don't want to pee. Yeah, it's a bit strange, really, sort of thing. And then they obviously then inflate your bladder. As you emptied your bladder before coming in for this procedure. They inflate your bladder enough to see inside it. I had a low bladder capacity. They didn't inflate it that much. I think if you've got a normal bladder capacity, they might inflate it a bit more, obviously, to see the bladder clearly inside. Obviously, you warn them, you tell them if it's feeling a bit full, and they won't push it beyond what would be classed as comfortably needing a pee, because I say this is not a particularly comfortable procedure. It's not. You shouldn't be in excruciating pain unless you've got strictures, or women. You might be suffering with interstitial cystitis, in which case they again this procedure may just be unbearable. But for the majority of people, sort of thing, yes, it's an embarrassing procedure. Yes, it's an uncomfortable procedure, but if they've done their job right with a lidocaine, it should not be painful. Like, so then at the end of the day, guys, you've got a much shorter shaft. The lidocaine might get up as far as the sphincter, and it may hurt less. No, mine, the lubricant didn't get that far, or the local anaesthetic didn't get that far. Yes, there's pros and cons of being well endowed, unfortunately. So anyway, he had a good look around in the bladder, had a good look at the lining. They can bend the head back. You can actually see where it comes up through the sphincter, and you can sort of see a red outline of the prostate sitting below the bladder. They show you the ureters, and you might be lucky enough to see them contract. Because I had a bifid urethra, there was always a risk of me having bifid ureters, which means I could have had 4 ureters basically. I've only got 2, which again causes less complications. I suppose the whole process from being prep to finish is about 15 to 20 minutes. I suppose the time that their cystoscopy is scope is actually in, it's probably about 5-7 minutes. No, they weren't expecting to do anything more than just have a look in mine. If you're having other things done, like maybe a biopsy or Botox injections, the process might take longer, but it's not an unbearable procedure. So please don't be scared if you're bricking it about going in for a cystoscopy. I've read a lot of threads, especially guys who suffer from prostatitis, where they sort of been referred for cystoscopies. Unless you're prepared to go pay private sort of thing, you cannot miss your opportunities, really, because the waiting lists are so long. I think I waited 8 or 9 weeks, I think, for my I was booked in the June, and it was early September, so we were maybe talking 12 weeks that I was waiting for my flexible cystoscopy. So you don't want to get there and turn around saying, sorry, I'm not having it done, just for the sake of being scared. I said, at the end of the day, if you've got a normal urethra, it's not a lot to worry about, guys. If you're like when you've got a bifid urethra, yes, it's your opening is smaller. If you've had investigations done before and they know what they're looking at, then this may be a bit different. A lot of bifid urethras discovered early on in children. I never had no reasons to have anything done until this problem occurred when I was 33. And to be honest, it it's not. It's something my wife didn't really know until I'd actually showed her up close. So it's not an obvious thing, even if you've been examined by doctors for basic medicals or whatever as a child. So anyway, so just, once they're happy in what is inside your bladder, they'll pull the scope back out again. They did mine quite slowly just to make sure that the main urethra didn't branch off into a secondary urethra. It feels a bit strange as it's coming out because it's still running water. It's dragging lube and it's dragging water, and it feels like you pee yourself when it comes out. It's a bit weird. And then you feel, yeah, it's a strange, unless you've had a cystoscopy, it's a strange feeling because your bladder sphincter has now been aggravated, your shaft has been aggravated, and it kind of feels like you want to pee, you don't need to pee. Yeah, it's an uncomfortable feeling, really. And he did check the other. He did try putting some gel up um, the other, the other urethra opening. I think it was barely the depth of the nozzle on the lidocaine. So it was only about inch and a half. But obviously, my first inch and a half of my urethra is probably narrower than the main part of the urethra. So likely it did get a fair stretch in with the scope. So anyway, they leave you to clean yourselves off, and you go back, get changed. I think it's standard procedure because obviously they filled you up with fluid. You're going to want to go for a pee before leaving. My journey home is about 45 minutes, so you need to pee before leaving the hospital. But I think the standard procedure, they want you to pee anyway. And I went for a pee, and I thought, oh, stings a little bit. But I thought this is as bad as it's going to be. This is not so bad, really, sort of thing. No, journey home, you're agitated a bit because, like, again, you feels like you need to pee, you don't need to pee. It's a very strange feeling, sort of thing. It does pass. They recommend you drink plenty of fluids to flush anything out of your bladder when you come home. It was about an hour and a half, I suppose, after I got home, the lidocaine wore off. Now, I would advise anyone, certainly that's got a small urethra opening, to ask for lidocaine gel on being on leaving the urology department, sort of thing. I was caught a bit off guard, really, because what I read online, you get a bit of burning, bit of soreness, sort of thing. You think, well, it can't be that bad. No, I've never had a urine infection, but it's something that you would imagine is no worse than having a urine infection. I had some diluted squash. Didn't want to drink too much, but enough. And the first time I went for a pee, it felt literally like I was peeing battery acid, screaming out in pain. And because I don't pee that well anyway, sort of thing, it's not like you can have a short burst and it's all over. It's a bit of a prolonged period, and then when you do actually finish peeing, your shaft is throbbing. I stupidly didn't take no ibuprofen or paracetamol. I would advise you to have ibuprofen and cocodamol as soon as you get home, because the local anaesthetic wears off quite quickly. And I would really, for the sake of it, I would advise you really going home with a tube of lidocaine, even if you feel you don't have to use it. Because I wish I had. I do wish I had. And I had this pain lasted pretty much up until I went to bed. You was afraid every time you went to go for a pee. And it's not ideal, really, because they advise you to drink a lot, and then you don't want to drink a lot because you know every time you're going to pee, you're going to be screaming out in pain. No, my pain threshold is pretty good, but it literally feels like you're pissing glass or battery acid, razor blades, whatever you want to call it. By the time I got up the following morning, it was down to what I call ow, that hurts. I think by the evening the discomfort had passed, because you do need to go for a pee in the following hours just because your bladder is aggravated. Regardless of how often you normally pee, you'll go more often, or feel you've got to go more often. As you were drinking more to try and flush stuff through, you will be going more often. And by the following day, it has settled. No, my bell end was tender. for 2 or 3 days before I could sort of go back to sexual activities again. No, I had to be a bit careful handling my shaft because it is tender sort of thing. Now the flexiscopes get slid in and out, and it gets twisted sort of thing. And even with the lubricant in there sort of thing, you're having something done in a hole really that's designed for nothing more than water at the end of the day. So yeah, I would have. These are the sort of things I would advise. I had a rigid cystoscopy yesterday, which I'll go into on another video sort of thing. And a bit of advice on that is to pee into a jug of warm water. Don't burn yourself. It doesn't want to be that hot. Again, I'm quite lucky. I've got a lot of shaft length. If you're someone who's got not a lot of shaft length, you may benefit maybe by putting 4 to 6 inches of warm water in the bath and sitting in it. They tend to recommend this for women and children, and it does help. I said if you have the lidocaine, if you are in quite a lot of pain, you can inject a bit of that up after peeing, and it does work. It does settle it down, and then the next time you go for a pee, because the local anaesthetic gel is doing its job, it doesn't hurt as much. It's a bit hit and miss really. So no, because I'm doing this on the basis of a bifid urethra. If you've got a normal size urethra, your discomfort may be a lot less. If you've got a stricture or a large prostate, you might be suffering a lot more with the after effects of the cystoscopy. But after 2 or 3 days, it went back to normal again. Well, as much as my symptoms could go back to normal again, but the pain went, discomfort went, and you can sort of pee without thinking, "Ow, this is going to hurt." And that's basically about it, really, sort of thing. No, like I said, it's a bit of a daunting procedure, but don't turn up and think and back out of it, sort of thing, because they put you at your ease, and these people are used to. The staff are used to doing this all the time. They know you're going to be nervous. You've had a flexible cystoscopy before. Now, I wouldn't be concerned about going back and having another one, which I may have to possibly at some time in the future, maybe to have Botox injections. I shall cover that under my next video. Yeah, I can't say man up because it is a daunting procedure, male and female. Some people may find that even with lidocaine, is too painful, and you've got to abandon it for a rigid under general anaesthetic. But if you can bear with it, it is a bearable experience. And like I said, end of the day, it should not be a painful experience unless you've got problems that are causing the pain. It should not be because they have not administered lidocaine. This is all from a UK point of view. What they do in America, I don't know, but they should not be attempting this without lidocaine gel. And I think that's basically about it, really, guys. No, I'll see you in the next video. Cheers and bye.